All right, so we'll get started since now there's about 47 people and we're recording this. So I'll just have you guys over here. Okay. All right. So thank you all for coming. Thank you for anybody who's a Stony Brook student and not a Stony Brook student. Can everyone hear me okay? Does it sound good? Okay, good. So the goal that I want to try to achieve tonight is for everyone to walk away having learned something. I know for some of you who maybe earlier on in your dental career, this might be really some stuff that you don't know a lot about. For older classmen, it still might not be something that you know about, or it might be something that you know too much about. But I'm hoping to give you some basic updates about what licensure is, how it differs from board examinations, and what's really going on right now, because there's a lot of news happening regarding the pandemic and how that's going to be affecting licensure going forward. So let's just see if this works. So throughout the presentation, I want you to keep this in your mind. No state or territory in the US requires physicians or other healthcare providers other than dentists to undertake a clinical licensing exam that involves the use of live human subjects. The only other profession outside of the healthcare field that requires this is estheticians, hairdressers. So just keep that in mind as you go forward. So we're going to build a foundation so that everybody is understanding what we're talking about from the ground up. So licensure versus boards. Licensure is a process that every dentist or new dental student graduating from dental school must go through at least once in their professional career in order to practice dentistry. It's separate from the board exam. The board exams are required for you to earn your degree most of the time, and they consist of the NBDE Part 1 and 2, and as of this year, it'll just be one exam, the INBDE. Licensure exams, on the other hand, are, after you've had all that, are required for you to practice in a specific state. The MBDE board exams are created by the Joint Commission on National Dental Examiners, the JCNDE, which is a part of the ADA, and they're taken across the board by all dental students and all dental schools pretty much to prove that you've learned something in dental school and are worthy of receiving your DDS or DMD degree. In order to use that degree to practice dentistry, you have to get a license, which are given out by individual states. Does anyone have any? And I want to keep this interactive, so at any point that you have, I have the chat pulled up on another screen here, so just send a message, or you can feel free to interrupt me. Continuing on that theme, something that people who are of the younger dental school classes might be concerned about or know a little bit more about than the older students is the INBDE coming out this year. And now the DL OSCE is also coming out. It was already planned to come out, but it's coming out earlier. And these are both new exams that are coming out by the ADA's JCNDE. And just to reiterate, both assess clinical skills, but there are key differences. The INBDE is a singular board exam that eventually, in about 2 years, will completely replace the MBDE Part 1 and Part 2 and focus on cognitive skills, biomedical underpinnings, evidence-based dentistry, patient oral health, that kind of stuff. The DL OSCE is something that we're going to get into later, that is the ADA's new single licensure exam that is not going to replace anything for the time being and is focused exclusively on the clinical tasks that a dentist performs while providing direct chairside care. So with that, we're going to
get into it.
Anyone recognize that? Yeah, TikTok? Yeah. So this is the best way that I thought could be a little bit better than just putting a bunch of words on a slide and bullet points for everyone to kind of understand how licensure works. So now if we have the basic understanding that licenses are given out by the state, you can start to understand a little bit more detail. So each US state lays out different specifications as to what you, a person who's seeking to practice dentistry, must do to obtain that license. So 48 states accept some sort of standardized exam that you can take to qualify for your license. 6 of those 48 states also accept a postgraduate year, a PGY1, that after you complete it, you can apply for a license and be licensed in that state. And those are listed here: California, Colorado, Connecticut, I believe that Minnesota, Ohio, and Washington. 3 of those 48 states also accept a portfolio exam, which California piloted. It's accepted in California, Colorado, and Iowa. And one of those 48 states, which is Alaska, also accepts a PGY2 year. They're a little bit more specific. Now on the side here, you'll see some outliers. So one state, which is our state, New York, requires that you must complete a postgraduate year residency after you finish dental school. So after you finish dental school, you cannot just go work in New York State, which most of us know, but some of us might not. You have to do a residency, whether it's in New York State or in another state. After you do 1 year of residency, you can apply for a license in New York as a full practicing dentist. One state, which is Delaware, and these 2 states, New York and,
No,
yep,
no, it's me. I just want to correct you on one thing. I don't think the law has changed yet, so it's not after 1 year, it's after successfully completing a residency.
yeah,
So
yeah.
currently now, if you're in a 6-year-old surgery residency program, you can't just do 1 year of that residency and then apply for a license.
Oh, yeah. You have to finish a postgraduate residency.
They're looking to change that so that you can moonlight, where they're looking to change it so that all you have to do is successfully go through 1 year,
Yeah.
and then, but it hasn't been changed as of yet.
Got it. Thank you. So New York and Delaware are those 2 states that would make up the rest instead of the 48. And then lastly, Delaware requires you to take a very specific board exam that they create, as well as do either a PGY1 or a 4-year plus residency, or have already practiced for 3 years in another state. They have very specific requirements. And then lastly, DC, Puerto Rico, and the Virgin Islands require the ADEX exam, which is one of the types of structured exams that you can take, which we'll get into. So knowing this, the majority of the states accept some sort of exam, and we'll break that down again. So 48 states out of 50 accept some sort of standardized exam that you have to take to qualify for your license. 8 other states offer an alternative, which are listed there, which means that 40 states require some sort of standardized exam in order for you to obtain licensure, which is a significant chunk. I know it's not New York, so some of us might not be as worried, but a lot of us don't really know where we're going to wind up. And so most of us wind up, regardless of the fact that we're going to school in New York, taking some sort of licensure exam. So what are these standardized exams? So now we're going to delve into that a little bit. Have I lost anyone yet? Is everyone good? Okay. So there are 5 big regional testing agencies that offer exams that students can take to obtain licensure. The 5 are the CDCA, which is the Commission on Dental Competency Assessments, the CITA, the Council on Interstate Testing Agencies, credits, or CRDTS, the Central Regional Dental Testing Service, REB, which is the Western Regional Examining Board, and the SRTA, which is the Southern Regional Testing Agency. So the CDCA and the CITA are organizations that offer a certain exam called ADEX. And so a lot of the times in New York, you'll hear, oh, I took the CDCA exam, or I took the ADEX exam. CDCA is the organization that offers the ADEX exam. ADEX is the American Dental Board of Examiners, or American Board of Dental Examiners. They're a separate institution that created their exam that now these 2 testing agencies have picked up and now offer. And they are listed first here because they are accepted in the most amount of states. So each It doesn't matter where you take these tests, either through the CDCA or the CITA. Whether or not you take this test is really going to depend on where you go to dental school and where the test is offered. So mostly on the East Coast, like Stony Brook, you're going to wind up taking the CDCA. It's accepted in 48 states and in Puerto Rico, the Virgin Islands, and Jamaica. It's not accepted for licensure in New York, Georgia, and Delaware, and Alaska requires some additional testing. This is actually, I forgot to change this. ADEX is required for DC, so you could take either the CDCA or the CITA to be qualified to work in DC. And the content of the ADEX exam is a diagnostic skills examination OSCE, which is not, I want to make this very clear, is not the DL OSCE. The DSE OSCE is just a specific part of the CDCA exam that's already been in existence. It's a computer-based exam. Then there's the endo portion and the fixed pros portion, which you do on a mannequin, similar to what you do in simulation lab right now. And then there's a perio and restorative part that is traditionally done on a live patient. And this is the same thing for the CITA. So moving on to credits, they offer their exam, which is called the credits exam. It's accepted in 39 states, not accepted in those listed here. Some states require additional testing as well. A lot of states will require, if you take credits or REB or SRTA, that you also take a part of the ADEX exam. So usually it's just better and easier to just take the ADEX exam in many circumstances, but it depends on the person. And the content is that you must have passed the boards part 1 and 2. You do endo and fixed on a mannequin, and you do perio and restorative on a live patient, just like that. So what is the difference between the CDCA and the CITA? So these 5 testing agencies are just individual, some of them are like not-for-profits or they're conglomerates of dental boards throughout states. They're just the organizations that offer the test. I don't know if that question came in before I explained that. And then ADEX is the actual test that again is created by a separate organization that then the CDCA or the CITA offers. But these last 3 agencies, credits, REB, and SRTA, offer their own unique exam that they make themselves. So you can see it's similar in content to the rest of the exams, but there's no computer part of it. And the ADEX exam, you do not need to have passed your part 1 and part 2 board, and credits you do, at least that's what I found on the website. So I'm going off of that. REB is accepted in 38 states, not accepted in those listed. And again, some states require additional testing. And this one is similar to the ADEX exam in that it also has a computer portion. It's called the comprehensive treatment planning. And then you do endo on a mannequin. You do restorative on a live patient, and then they offer perio and fixed pros as optional. A lot of states don't require you in their specific guidelines to obtain licensure to do a perio portion of an exam in order to obtain licensure. So a lot of the times, perio sections are left optional. I believe it might even be optional on the ADEX exam, but a lot of states also do specifically require that you do take perio. So this in case, REB has left both fixed pros and perio optional, and they don't usually cost anything extra to then take them if you want to. Lastly, SRTA is accepted in 36 states, not accepted in those listed, and the content is endo, fixed, pros, restorative, and perio. And again, perio is left optional because not all states require it. So these, again, are the 5 big testing agencies that offer exams. 2 of them have picked up a specific exam called ADEX that the American Board, which is called, ADEX is the American Board on Dental Examiners. They make their own exam. And these 2, because they offer ADEX and ADEX is such a widely accepted exam, are most likely the ones that people in the Northeast wind up taking. And a lot of the times you have to go, certain dental schools offer these certain exams, and we'll get more into that, but it would be really hard, say, if you're a Stony Brook dental student, for you to even be able to take credits, REB, or SRTA, because you don't go to the schools that they're offered at. I believe NYU also offers REB, but the CDCA is offered at all the major New York schools. So does anyone have questions on that in the chat or anything? Don't see any right now. So we're going to move on. So again, the basics of layout of a clinical-based licensure exam. So the basics of any of those 5 exams are going to be a computer-based diagnostic skills examination. Okay, thank you, Katie. And the CDCA, CITEA, and REB offer these, and those are basically questions regarding simulated patient cases. Then there's a mannequin-based fixed pros section, which is you prep a premolar and a molar, and you also prep a single crown on an anterior maxillary tooth. So similar to what Stony Brook already does to prepare you in our courses. Then you have a mannequin-based endo assessment. So you have to prep and access and obturate one anterior tooth and just access one posterior tooth. Tiffany says, does the computer-based DX skills exam take place in Prometric? Yes, so a lot of the, all of these clinical-based, computer-based, diagnostics exams do take place in a Prometric testing site, similar to where you go to take your boards or where you took your DAT. So the next part of 5 is a restorative human subject part. And in that case, you do a composite preparation and filling on an anterior tooth and a posterior tooth, usually a class 3 in the anterior and a class 2 in the posterior. And then you also do the periodontal human subject. So you do a scaling and root planing on one patient of 6 to 8 teeth. Some states, again, do not require this portion, and most states make it most exams make it optional, rather. So the before were the 5 basic examination, 5 basic organizations that give the examination, and then these are the 5 basic components of basically every exam that they offer. So again, a computer-based, fixed pros, endo, restorative, and perio. Diana, your question we're going to get into afterwards. So I will answer that about failing the exam. So what's the issue with these big 5 testing agencies exams? Because obviously there's a lot of talk about what's wrong with them, wanting change with them, and the troubles surrounding them. So the big issue is live patients, and that creates a host of problems. And if you go back to what I told you to remember at the very beginning of this presentation, dentistry is the only healthcare field and one of the only non-healthcare fields that, in order to license their professionals, requires we do some sort of examination on a live patient. Our medical counterparts in the medical field don't have such a requirement. So the issues with having to solicit a live patient for an exam. So we're going to go through some issues. The first issue is validity. So studies dating back to the 1970s have shown a statistical lack of validity in clinical licensure exams. And clinical licensure exams is another way of saying live patient exams. Studies have shown no positive correlation between scores that students in their 4th year got and how they correlate with how they did in school. So in one study, almost 1/3 of candidates who failed their licensure exam were in the top third of their class, while the bottom 10% of that class wound up passing the exam. So there's no correlation that just because you're a better student, you're going to pass this exam. The next big issue is professional reliability. So this gets into Diana's question. Those who fail the exam, mostly, let's say, just the CDCA exam, whether due to misclassification or substandard work, are then permitted to take it up to 3 times, in most cases, with no remediation and no further training. So if candidates are not required to have further training after they fail the exam, they can continue to provide substandard care to patients until they get it right, or they just happen to pass it the next time they take it. And statistically, if a group of people fail the exam, the overwhelming majority will then pass it on the next time. And then the next issue is patient reliability. So despite the fact that each candidate performs similar procedures on a human subject, no 2 humans are identical, and therefore you really can't standardize the clinical examination. Variations are inevitable, and standardizing human subjects anatomically, physiologically, pathologically, and psychologically is completely impossible. So far, the big issues are validity, professional reliability, and patient reliability. The next biggest issue is ethics. So should we be using human subjects to discover incompetence? And this question has been asked for decades now, because you hope that the student taking the exam is competent to provide good care, but they're being tested on whether or not they are. So in reality, we're really subjecting our patients to discover incompetence. According to the ADA principles on ethics, dentists have a duty to protect and promote the welfare of their patients. And is doing this examination really promoting that? Each time a candidate fails the clinical exam on a patient, that patient might be left with a restoration or periodontal condition that is below the standard of care. A lot of times, if you're taking the exam as a student and you bomb out, there are faculty there to come and save that patient's restoration. But if it's substandard, the patient might walk away with a substandard care. The next biggest issue is inhumane treatment. So in this exam, patients are basically treated as a commodity. And for those of you who haven't taken the exam yet, this might be a little bit hard to understand, but when you're ready to take this exam, let's say you're taking the CDCA exam, and as we went over, there's the computer part, there's the two mannequin parts, an endo and fixed pros, and then there's the restorative and perio part where you have to have live human patients. So you take the computer part at some point. I know in Stony Brook, they took the endo and I believe fixed pros early in the fourth year around September. And then back this past February, right before the whole pandemic hit, they took their live patient portion. And they were going around clinics for months beforehand, and there were signs posted everywhere asking patients and screening patients, and even sometimes taking patients away from students who are younger in order to preserve that lesion that looked like it was a good class 2 lesion that could have been solved in late December, early January, and ask the patients to hold on and save that cavity until the exam in February so that they could use it for their licensure. So many patients that are used for the exam aren't even the students or the school's patient of record. They might just be there for the exam. They might be your friend. They might be your family member. And most every time, they're just there for their free treatment because they don't get charged and a cash payment. So there's no real way to follow up care, and there's no comprehensive care of the patient or really consideration for systemic factors. They do a medical history background, so you know a bit about the patient, but you're not following up traditionally with that patient. And patients are often paid, purchased, or sold, or traded when a candidate can't find a patient who qualifies for their exam. So in almost every school, I know it definitely happens in Stony Brook, and it's not taboo, it's just a fact, and anyone will state it, is that you have to offer your patient money for them to come in. It's an incentive. The care is free, but to incentivize them to come in, you often have to tell them, hey, I'll give you $100 cash on the day of the exam if you come in. And then sometimes friends of yours might reach out to that person because they know that you got them and say, hey, I'll give you $200 if you become a patient for me. And there's nothing really you can do about that. So it creates a lot of bargaining and a lot of problems. So patients can even call you the morning of the exam and refuse to come in unless you pay them more money, basically holding the provider hostage to pay ransom for their participation. And I've seen this happen this past year. And a byproduct of this whole environment of having to pay patients to come in and be your patient for the day has actually led to the creation of businesses in order to provide patients for candidates at a very premium price. So some companies have been created that claim that they can provide your patient, your documentation, even your assistant for the day, because everyone who's taking the exam has an assistant that day, and can help you prepare for the course for prices upwards of $12,000. And the exam itself already costs almost $2,250. And then to have to pay that is, very substantial. And even if you don't pay $12,000, some students wind up paying $200, $300 more dollars than just the $2,295 to pay for their patient. And then the provider who's taking the exam usually also pays their assistant. And the assistant could be their friend from dental school, one of the dental assistants from the school. So it adds up very quickly and it creates a lot of ethical issues. So is there any questions about those issues that we just went over, or about why? Oh, okay. There's a lot going on in the chat. If the patient fails to show up, is there reimbursement? No, Katie, right? Because this is the one part I probably don't know.
In terms of what
No, there's not.
Yeah.
In terms of reimbursing,
like Gerard, if you're in terms of the patient, usually you didn't give the patient the money ahead of time. You give the patient the money when they're there, right?
You
so
don't get reimbursed from the testing agency, and it counts against you.
so it won't count against you. You can, as long as you tell them like in advance of when you're going to challenge it that day, because we had this question this year when we took CSA, it won't count as a failure. But if you are going to then have to take it again at another site, you're probably going to have to pay the $500 fee to take that portion at another site. So like, let's say your class 2 patient's in the show and you don't take that, then it won't count as you failing it, but you'll have to pay $500 to take it at a different site on another day. And also, yeah, so all this money is out of your pocket. So you're paying your patients from your own money in addition to the money that you're paying to take the exam.
Yeah.
The only time you're reimbursed from the testing site is picking up where Jack left off with, let's say, a class 2. If the faculty reviewing the class 2 lesion signs off on it, but the testing agency says, no, it's not good for the test. As long as the faculty signed off on it, they will reimburse you. Of course, you can't take the test that day, and it comes with a whole other host of problems. You won't be charged for the faculty signing off.
Yep. So thank you. These are really good questions, and thank you guys for your input. And then the last thing, I don't know if Steffi is on here. The last big factor.
I am.
That's an issue. Oh, why is it not doing it now? Is PTSD for CDCA runners, especially if you're in the.
Did you forget about me, Joe? How quickly you forget?
Oh, hi, Chloe. Yeah.
Yeah.
CDCA
My feet are
runners,
still in recovery.
the CDCA exam also takes on some students from the school usually to be runners for them, and the CDCA itself will actually pay you, like me, Chloe, and Stephanie were runners this past year, so they're often the patient care that's being provided by the student taking the exam with their assistant is going on in one area, and then there's a whole separate area where they get examined, and there's a bunch of dentists who are the examiners and a bunch of students, us runners, who are running people to clean things, and there's a projector, and it's very traumatic. But yeah, these are a lot of the reasons why.
Not as traumatic as taking the exam.
Well, yeah, I can't say that, but it was definitely not the best couple of hours. So these are the big issues that have to do with live patient examination. So because this is an ASDA lecture, if you're wondering what ASDA thinks about this, we do have an L1 policy, and ASDA understands that there are alternatives and that they are preferable to the current process. However, we believe that the ideal exam does not use human subjects or live clinical testing, is psychometrically valid and reliable, even going back to the reliability factor of live patients in its assessment, is reflective of the scope of current dental practice, and is universally accepted basically by every state and territory. ASDA believes that demonstration of both a kinesthetic and a clinical decision-making competency is necessary to obtain licensure. So kinesthetic meaning using your hands, doing some sort of hands-on part, which we already do in the exam on a mannequin, like such as endo or prost, but not doing it on a live patient. And they believe that this should be demonstrated through mannequin-based assessment, a non-patient-based OSCE, submission of a portfolio, and you can read more about this in ASDA's white paper, which dates back to 2016, but that's basically ASDA's L1 policy in general. Stacy, if we complete a residency after dental school, then is there a reason to take an exam like the CDCA to practice in another state? Can we practice in another state just completing residency? So going back to the slide that I had earlier, and I'll go back there if you'd like, we have, actually, I think I could just scroll right here and go to it for you. So you guys can see that, right? Okay. So these 6 states here are the ones that accept a successful completion of a postgraduate year 1 program, as well as New York, because they require it. I just separated them because they also accept, these 6 states also accept a exam. So if there's a reason being that maybe you only ever want to work in New York and you know you're never going to move, then you could just do a residency, complete it, and be licensed to work in New York. And you would also then technically be able to, if you wanted to in the future, apply to be a dentist in California, Colorado, Connecticut, Minnesota, Ohio, or Washington. But you would not be able to go to the remaining states that don't accept a PGY1 as a way to licensure. But there are details that I didn't get into, that because I don't want to overcomplicate things, that if you're a practicing dentist for a long enough amount of time, sometimes 3 or 5 years, you can apply to a certain state's dental boards to be grandfathered into their program without having to ever take a license. So if you wanted to get into one of these 48 states that requires an exam without ever taking one, you could do a residency year and practice in New York for a year, for maybe like 5-6 years, depending on the state, and then go to apply and say, hey, I've been a practicing dentist for this long already, and there's an application process to go into that. But I wasn't going to go into too much detail on that because it gets a little bit hairy. So I think that kind of hopefully explains your question. So we're going to now you know the kind of issues that have to go with live patient exam, and we're going to go into a little bit of a historical timeline as to the movement away from that exam, because everyone kind of is in agreement now and has been in agreement for a pretty long time that we should be moving away from live patients. So Dr. Richard Buchanan, back in '91, who is a former dean of Rutgers, and a former member of the American Association of Dental Schools and the American Association of Dental Examiners, said that entry-level exams using human subjects are now absolutely inappropriate. And then he goes on to say some other things there. So this was kind of what everyone pretty much defines vaguely as the beginning of the end of wanting or accepting live patient licensure, and the beginning of the movement to move away from it. And we're still not there. We're still working, but we've made a lot of progress thus far, especially this year. So here's a little bit of timeline on the live patient licensure history. So again, in '91, Dr. Buchanan's statement that entry-level exams are now completely inappropriate. Then in 2000, so about 9 years later, the ADA House of Delegates adopted a resolution which called for the end of human subject use in licensure by 2005. And obviously that did not occur. And after that, there were similar resolutions that were passed in the ADA House in 2005 and 2006. Almost a decade later, nothing had really happened, and the American Dental Education Association, ADEA, came on board and published its updated policy statements recommending that by the year 2015, the live patient exam for dental licensure should be eliminated. And here we are 5 years later, and it still hasn't happened. 5 years after 2015, that is. And then in 2016, ASDA got on board, and the ASDA House of Delegates adopted its L1 policy, which is what I just read to you a slide or two ago. And it also published its white paper on the use of human subjects in clinical licensure exams, which is what a lot of this information that I'm presenting to you is based upon. So what's next? Because obviously since '91, people have wanted to eliminate the use of live patients, and we still have not. So what came after that was the Coalition for Modernizing Dental Licensure. So in September of 2018, which is not that far ago, the ADA, ADEA, and ASDA came together under the Task Force on Assessment of Readiness for Practice and released its report on modernizing dental licensure. And you can read that report, it's called TARP for short, at this URL here. And then a month later, I'm sorry, before we get to that, the report addresses 2 priority concerns. So the use of a single encounter procedure-based examination on patients as part of a licensure exam, and the mobility challenges that are burdensome and unnecessary for a patient's safety. So a month later, this task force became the Coalition for Modernizing Dental Licensure, CMDL. And the mission of the coalition is to ensure patient safety, increase access to care, and promote professional mobility by modernizing the dental licensure process. And the coalition will advocate for licensure reform and is committed to 2 key goals similar to what TARP was. The first goal is eliminating single encounter patient-based examinations and replacing them with some sort of clinical assessment to have a stronger validity and reliability. So again, those 2 issues coming back to what we talked about before. And the second mission is to increase the initial licensure portability to allow professional mobility and improve access to care. And in case you're wondering, portability and mobility are just meanings that they want to create or advocate for a licensure exam that once you take allows you to practice your profession in any state in the country. That's the big overall goal. So Katie and Jack are talking. Good, thank you. So this is the new kid on the block that everybody's talking about now. The Dental Licensure Objective Structured Clinical Examination, or DL-OSCE for short. It was created by the Joint Commission on National Dental Exams, which is run by the ADA. And you can see underneath here, the JCNDE is an agency under the ADA responsible for the development and administration currently of the National Board of Dental Examinations, the MBDEs. So they're the same people, the ADA, who create our board exams. And they're a 15-member commission that include representatives from schools, practices, states, examination boards, hygiene, students, and the public. So this DL-OSCE is a completely computer-based virtual OSCE. It is focused exclusively on the clinical tasks that a dentist performs while providing direct chairside treatment. The use of a traditional mannequin hand-based skills is not included. So back when we talked about what ASDA's ideal licensure exam is, we advocated for, ASDA advocates for, a kinesthetic portion where you get to show using your hands and a computer or examination portion. So this exam, and ASDA is part of the coalition with the ADA, and the ADA is releasing this examination. But technically, it does not meet the standards of what ASDA hopes an ideal licensure exam is, because this examination is taken completely on a computer. You go to a Prometric site, just like you do for your boards and just like you do for your DAT, and you take this examination. There's no part of it where you're seeing patients or providing care. The topic areas that it focuses on are restorative, prost, oral pathology, pain and TMD management, perio, OS, endo, ortho, med emergencies, and prescriptions. The areas covered in every single topic include diagnosis, treatment planning, and occlusion. And each form of the DL-OSCE must include at least one of the one item involving each of the following types. So pediatric, geriatric, special needs, and medically complex patients. So it looks to be an overall very comprehensive OSCE clinical-based exam that's all completely done virtually on a computer. So these are 2 example questions. I'll show you the second one in a second on what a OSCE question would look like. What it would look like if you were sitting in a Prometric center about to take this exam. So it says select one or more correct answers, which describes the MO composite restoration on tooth 19. And in this square, there would be a 3D model that would be rendered and visible to you taking the exam. You could drag and rotate it, see around the tooth, and view it from every different angle. And you would have to say, is it acceptable, unacceptable, why is it not acceptable? And you basically describe it in every way, and there's not necessarily just one correct answer. There's maybe more than one correct answer. And again, I kind of already went over this exactly in my beginning, but the JCNDE, again, is the part of the ADA, and they create the MBDE exams and will be creating the INBD exam, the Integrated National Board. And now they've also created an exam, the DL OSCE, that they're hoping we can use across the board for licensure. So then if they did, you could pretty much take the ADA exams for everything throughout dental school. So this, I'm going to go back one slide. So this exam has already been in the works for a while now and was slated to be released later this year, and just finished its piloting study actually at the beginning of this month. But in order to push it ahead because of coronavirus.
Coronavirus! Coronavirus!
So, sorry, when coronavirus came along, the OSCE got pushed up, and we'll go into that in a slide. So everything was all fine and good. We had the Coalition for Modernizing Dental Licensure, and the ADA was going to push out the OSCE later this year, and then it would be up to states to approve it. But then the pandemic hit. And now there's a situation that everyone has to deal with. What do we do with these 2020 graduates that many of which have not taken their licensure exam, or in many circumstances took their mannequin-based portions and computer-based portions back at the beginning of last school year, so maybe in August or September, but have yet to take their live patient portion for restorative and perio? So all of the big 5 testing agencies that we went over have now come out with some sort of solution or a resolution to the issue at hand. So we'll go through each of them. So the CDCA, so again, the CDCA and CITA are 2 examination organizations that offer the ADEX exam. So on April 3rd of this year, it was announced that ADEX will allow the restorative portion of the exam to be completed on a typodont tooth using their new patented Competent diagnosis and treatment teeth. So this should be available early this summer. They're shooting for June. But as far as I could find, they did not address the alternatives to the optional perio scaling on live patients. And many states do require that you do a perio portion in order to receive licensure. And the CITA is the exact same thing because they offer the ADEX exam. So ADEX came out with, again, this new typodont teeth, and now you can, hopefully come June, when students are allowed to slowly get back into school and use a preclinical center, use and take this exam on a typodont. Now, the last 3 accrediting agencies, or testing agencies rather, who offer their own exam also came out with updates. So Credits has made their own all mannequin option available as an alternative. And this includes both a restorative and a perio section. So, and they're really one of the only ones to have done this at this point. They did not really give details on exactly when that would become available, but it probably would be sometime within the coming month or 2. REB on March 26th informed ASDA in a letter to us that they were fast-tracking a non-patient-based exam to be implemented this year. And on their website, it states that an option for examination under the current COVID crises would be a written authentic simulated clinical examination, or an ASCII exam, and a mannequin-based operative endo and prost. And this can be done as early as June of this year. But similar to the CDCA and CITA, they did not address what's happening with their perio scaling portion. And the SRTA on April 13th of this year said that they have made a mannequin-based restorative portion of the exam available as an alternative, but they, again, did not address the optional perio scaling. So all 5 major testing agencies across the United States have now come out with some sort of statement in response to what's going on right now about how students, specifically the graduates of 2020, will be able to obtain licensure and complete their examination. Chloe, did you still have a question, or did Katie answer it?
I'm just reading Katie's response.
I want to add on to it, Joe, or elaborate.
Yeah,
Everybody.
so the major differences between this OSCE, I'm assuming you're saying, meaning the DL OSCE, and the MBGE Part 2. So the MBGE Part 1 and Part 2 are really just more so to assess your education on what you've learned in dental school. And the DL OSCE is an attempt to quiz you on more so clinical stuff. So it's in the same way in which just because you learn all this stuff about biomedical sciences and everything that you learn in school may be easily tested on the boards, what you would be doing in a live patient is assessing your clinical competency. How good are you at doing things clinically? How good are you at drilling a crown? How good at you are doing an endo or filling a cavity? And the OSCE, the DL OSCE, would be an attempt to really ask you more questions based off of that. It would try its best to put the clinical scenario digitally. Is the DL OSCE becoming a thing that every student needs to take and get their degree or license? Is this what's happening and hoping to replace the CDCA? So we'll get into that, Devin. So again, these are the 5 big examinations, all of which have traditionally offered a live patient portion to their exam and now have all come out with a at least temporary method, way of completing the examination for the class of 2020 on a non-live patient. And the hope is that after this year, being that all these associations have all these associations didn't just in a month say, okay, we're just going to create a non-clinical portion. Here's our type of tooth. We were able to do that in a month. They've been planning and developing behind the scenes their own versions of a non-live patient because it's eventually what's going to happen. The hope and the excitement is that now that all of these organizations have come out and said, here's an alternative to a live patient exam, even though it might not be perfect right now, the hope is that that might become somewhat permanent or stay as an option for the near future. And what about the DL OSCE? So this is getting back to Devin's question. So now where this examination moves to is state dental board acceptance. So the exam was originally slated to be released, I believe, in August of this year, and had been piloted for the past year or two, but now has been moved up for a release date of June 15th in hopes that state dental boards will approve it and use it per state as an option to obtain licensure. And in order for this exam to be utilized as a means to obtain licensure, it must now be adopted by state individually as an approved pathway. And more specifically, it has to be approved by the state dental boards. And we're going to get into that to a second. So I'll continue to answer the question, Devin, in a second. So now we've heard that the big 5 examinations have said that there's an option for you to do your examination on a non-live patient. We have the DL OSCE open. So that's it, right? There's no more live patients. We never have to work on a live patient again. Well, that would be wrong. So now, like I said, the ball is in the state's courts, and states and or state dental boards must now come together and decide what they're going to do and what's a suitable pathway for licensure, possibly only during COVID-19 or maybe for a year or possibly permanently. It's up to the states now completely. So because of that, we're going to just delve a little bit into what a state board of dentistry is. So the State Board of Dentistry or the Board of Dental Examiners or the Board of Dentistry, whatever it's called, is an agency of the state created by the state legislator. The agency governs the qualifications and the practice of dentistry within that state. And the board has the authority, and the board's authority, rather, is limited to what the state grants it and typically includes the board is able to establish qualifications for licensure. It's able to issue licenses to qualified individuals. It's able to establish standards of practice, and it can take disciplinary actions against people who engage in misconduct and promulgation of rules to enable the board to perform its duties. So it can create rules on its own. The state dental board is the appropriate agency to contact for the most up-to-date information around what's going on right now. And to get into your question a little bit more, Devin, for some states, licensure requirements are set by the state dental board, which is usually a part of the Department of Education or Labor. And if that's so, any such changes to what a state approves for licensure can be approved by a simple board vote. And if it's approved, it's changed. However, in some states, licensure requirements may be actually written into the state's laws. In that case, these changes to the requirements for licensure in a certain state would require the state government to actually vote on it, and that change to be signed into law by the governor. And it depends on which state. So the hope in the ADA releasing this DL OSCE is that it will eventually be accepted by an overwhelming majority, if not all of the states, as a pathway to licensure so that you can have complete portability, take the exam at the end of your dental school career, and be able to practice dentistry anywhere. However, like anything in life, it's not going to be that easy. It's going to be up to the states. And there's 5 big testing agencies, as we've went into, that have a lot of money and a lot of power and have a long history of giving examinations. And they're not going to be they're not just going to lay down and just stop giving examinations. So it's something that the ADA hopes, and it's the option that the ADA can now say, hey, we've created something that is very clinically relevant, that doesn't include the use of a live patient, that has been shown to be valid and reliable way more than using a live patient. This should be accepted. And the state dental boards now have to go state by state and approve that. And some will and some won't. And some have already made changes, and that's the next slide that we're going to go into. Okay, just looking at the chat. So what states have done so far? So as of today or yesterday, this is some information and updates that I've gotten for certain states. So in Arizona, they are giving a provisional licensure for 6 months for 2020 grads that will suspend after 20 days once the in-testing centers reopen. Similar thing in Idaho. In Louisiana, similar temporary licensure. In Tennessee, again, similar thing, temporary licenses. In Iowa, they have actually approved the use of the DL OSCE for 2020 grads. And the same thing in Washington. They have approved the DL OSCE as a pathway to licensure for 120 days once filed, and meaning once this law is filed. So other states have temporarily suspended their license and licensing exam, and you can practice under a provisional license with the supervision of a dentist. In Pennsylvania, 2020 grads do not need to take the perio portion, and the board will accept the CDCA's mannequin-based portion that they just came out with those new typodont teeth. Same thing around Mississippi, and again, a temporary license in Utah. So that's what's going on right now. These are the state dental boards that have responded. ASDA, as an organization, has sent letters to every single state dental board in all 50 states. Some of them have replied, some of them haven't. These are the ones that have made the most change. Some of us have told us that they're just working on things, but for the past probably 2 months, ASDA has really been busting its butt, getting out there, writing letters, and to any state that didn't have a dental school in it, we are also sending letters directly from Sydney, the ASDA president, asking them to consider changing their licensure requirements for graduating students. Is there any questions about this? No?
Any news from New York, Joe?
No,
New
and
York's not going to change because we require a PGY1.
that's actually the next slide.
Right.
So
Okay.
a look inside New York. The only state to mandate a PGY1 as the sole pathway to initial licensure. So before December of 2016, I believe New York State accepted NERB, which used to be the CDCA, and had its own exam as well. I tried to scroll through all the PDF and find what was existed back then. But regardless of what happened back then, As of January in 2007, all applicants for licensure must complete an approved clinically based dental residency program of at least 1 year's duration, also known as a PGY1. So this can be any residency program, including a GPR and an AEGD in most cases. And a clinical exam such as the CDCA will not be accepted for initial licensure after December 31st, 2006. So again, the only way to become a licensed dentist in New York is for you to successfully complete a residency program, either in New York or outside of New York. Katie, 2016 or 2006? Did I put 2016? Oh, sorry. Before December 2006, sorry. So like Jack said, there's not a great chance of New York budging, because New York has already been put in its way that for whatever reason, we want to make sure that students are having at least 1 year after residency to become a dentist in New York State. I think it would be great maybe if they approved for the, DL OSCE or something like that, but most likely they're going to be one of the hardest states to push to budge because they're very set in their ways after 2007. Another look inside another state, Connecticut, which is where I'm currently at right now. It is the first state with plans to ban live patient-based licensure exams. So in 2006, it required the NERB, which is now the CDCA. In 2007, 2006 and before it required that. In 2007, it accepts now the ADEX exam, or one of the three others, credits, REB, or SRTA, plus the computer portion of the ADEX. And it also accepts a PGY 1 year. So you can take the ADEX exam and be licensed and work in Connecticut, or you could take a PGY 1 year and also be licensed to work in New York. So if you went to school at Stony Brook Dental and you said, well, you know what, I know I'm either going to work as a dentist in New York or Connecticut, you don't really have to take a licensure exam if you really don't want to. You can just do a residency program, successfully complete it, and you'll be able to apply for licensure in both New York and Connecticut. And lastly, in 2019, they passed legislation in the state of Connecticut which prohibits licensure exams which include live patients beginning July 1st of 2021. So as of next year, July 1st, which is right after my class graduates, they are going to prohibit licensure exams that have live patients. So I don't know specifics because this was just mentioned in a webinar and there's not a lot published on this. But I'm not sure if that means if you took the CDCA exam that it's not going to be accepted in Connecticut because they're not going to accept any exam that was on a live patient, or if that means that they're just not going to allow the CDCA exam or any live patient exam to be offered in the state of Connecticut. But either way, this is a big change, and it's the first state really to say specifically that they do not want to have a live patient licensure. You could make the argument that New York also did that by banning any exam, but Connecticut's the first one to come out with this. Chloe, the country would need a lot more programs. Okay, good. Any other questions about this?
Hey, Joe, do we know how this, for those in years 2019 and prior who didn't pass a licensure exam or now have to retake it if they want to be licensed, does none of these things then, like, they're not allowed to I don't know, I guess, how are they being affected, I guess, because
you're like in 2019 and you took the CDCA?
So, for instance, for me, I failed the CDCA enough to which I have to now retake the entire exam. I'm in residency right now, so once I finish residency, I can practice here in New York.
Yeah.
But I can't practice anywhere else.
So I'm in a Facebook group with fourth years and like other people from around the country talking about like licensure and stuff, and it's really state by state. Like one anecdotal example I know of is there's a Prost resident who's finishing Prost in California in July or June. He took Reb when he was in dental school in 2017 and passed it, but at that time Reb didn't have the fixed pros portion as part of it, and then it was added after that time. But he passed Reb at the time, is completing his pros residency, but because he didn't take the pros portion of Reb, he can't use Reb to get a license in California right now until he takes the pros portion, despite the fact that he's going to be a board certified prosthodontist. So even if you completed an exam beforehand, most states are still abiding by whatever laws they had and are really only making exceptions for the class of 2020, unfortunately, if they even are making exceptions at all.
Thanks.
Anybody?
And like most states, like California now accepts 8X. However, it's only if you've completed it after they signed it into law on November 15th. So for example, I completed the mannequin portion at Stony Brook in September, and then all other portions after November 15th. However, since I did the endo and fixed portions before November 15th, I can't use that to apply for a California license. And anyone who had taken it previously and completed any portions or all portions for then also can't. So a lot of states are still holding true to like their, things that they had instituted before COVID.
Okay, cool. Thanks.
Anybody have any other questions?
There was questions that some people had private messaged me about regarding if you didn't do like GPR AGD and did a residency, can you then use that to get a license in states that require like a PGY1? And it really depends. Some states won't allow it and will still require you to take one of the licensing exams. For example, the person I was just talking about in California who's completing cross residency but still needs a licensing exam to get a license. And that's why sometimes students from Stony Brook who go on and do like a PEDS residency or OS, you'll see them come back near the end and take CDCA with the fourth years who are taking it, because states, regardless if you did a regardless if you did a specialty program at, will still sometimes require you to take a licensing exam. So it really depends on the states, and you have to look at each state's requirements.
All right. So, what exam to take? What exam you will probably wind up taking will depend on where you went to dental school, where you're from, where you hope to practice, and what you want to do in dentistry. If any, being that a lot of you are in New York, you're most likely going to wind up taking the CDCA. And it's probably a good option. Again, you can take a PGY1 and successfully complete it and be licensed in New York and Connecticut, but you never do know what your job offers are going to hold. The CDCA via the ADEX exam currently has the greatest portability, and it's given in all New York State dental schools. And so we're really going to finish off this presentation with just a look at the CDCA, since that's what is going to be mostly relevant to the majority of us. So we're going to specifically talk about, because we already talked about the components of the CDCA, the fact that there's a computer portion, a mannequin endo, mannequin prost, a live patient portion restorative, and a live patient portion perio. Now there's a mannequin-based restorative on a typodont. They haven't really addressed the perio. So you kind of understand what the exam entails. We talked about having to pay patients to come to it. But lastly, I found this very interesting, and it might be more so significant for pre-dentals if there's anybody watching, but anybody, especially third years, should really pay attention to this. So there's actually two ways that the CDCA exam can be administered: the traditional method and the curriculum integrated format, CIF, aka the patient-centered CIF, aka the CDCA Buffalo model. Stony Brook participates in the traditional method, whereby you heard about Jack talking about taking the endo and pros portion early on in fourth year, and then in February taking the perio and restorative portions. And those perio and restorative portions are usually done on the same day in a weekend. So when I volunteered for it or worked it back in February, it was all on a Saturday, and all of the clinical examination was happening then. And it's all condensed to one high stakes, very nerve-wracking day. Traditional exams have all the clinical portions taken over a 2-day period and are often open to all qualified candidates. and anyone really can take it whose school does not participate in the other format. The CIF format can only be taken by students who are about to enter their senior year of dental school or graduate students at a school hosting the CIF format exam. So the only way to take the CIF format is really if your school participates with it. And in this format, the exams the clinical portions of the exams are taken over a period of months and are open to current fourth year students at their school and who've received authorization. And again, Stony Brook does not participate in the CIF format. We follow our traditional model. So the CIF model has faculty and curriculum integration. So in the integrated CIF model, the CDCA actually calibrates the faculty who already work at the school on identifying correct and appropriate lesions specifically for use in the exam. And they do the same lesions that you do in the traditional model. Faculty then approve the lesions on the patients prior to them taking the exam. Then they host an exam day, usually during regular clinic hours, and the treatments occurs on patients of record. So that is much better than sometimes patients who are not of record in the traditional model. And when the candidate treatment if the candidate treatment is incomplete, then all the patients will receive treatment to completion by the faculty. Patient eligibility and procurement is much easier. Candidates don't have to search for their patients or perfect lesions typically as much like they do with the traditional exam. And the treatment is only rendered on patients of record as part of an appropriately sequenced treatment plan. So similar to how we in Stony Brook have a very comprehensive treatment plan, that restorative portion could be used as your examination for the CDCA. And multiple exam dates are often available and retakes are offered to all exams. Multiple exam dates are scheduled. Candidates who have patients who don't show have additional opportunities to take the exam without an additional cost. And candidates that do not pass the exam are able to challenge the exam at a later date for a retake fee. And the exam is really part of a normal clinic day. So since the exam is integrated into that time, there's really minimal disruption to the candidate's academic schedule. So this is like the Buffalo model, as it's commonly called. In my opinion, it's a very nice model, and I wish that more schools followed it because it makes the patient portion that we're trying to get away from at least a little bit more ethical in the fact that it integrates the examination, the live portion of the examination into your regular clinic-based care with patients who are already patients of record, and moves towards a little bit more of an ethically sound exam.
I thought so too, but then I spoke with Dr. Nasty and some faculty about it and administration, and it's better in some regards for sure, but it's still not perfect.
Yeah.
And it still is a lot of stress and requires that like there's a certain area of clinic blocked off like for any students like taking that exam. So it's still like a standardized testing like format, requires like your patients to still be there for normally extended periods of time than what their normal clinic appointment would be. Requires to still have set dates when the examiners who are going to be, allowing you to challenge the exam will be there. So it still takes some coordination in that regard. So yeah, it's nice because it offers like more time to take it as opposed to just like one day per se, but it's still not ideal and it still doesn't really help a lot. And in a small school like ours, it wouldn't necessarily be the best option or the most feasible.
It still doesn't address a lot of the ethical concerns that a live patient exam brings up. But that's pretty much the end of my presentation. These are some quick links to stay informed, as is website, the ADA, the CDCA, Prometric for anyone who's taking their boards, or the computerized portion, some references, and any questions that you guys have for me. I'm going to stop sharing my screen.
Oh,
Yep.
I'd just like to thank you and ASDA for putting on this. I thought it was very informative. It was fun for me to watch because the same questions you guys are facing are the same questions we were facing 35 years ago. This has been an ongoing battle for as long as I've been in dental students, which was a very long time ago. So thank you and ASDA for a great presentation. I think it was very helpful I know I found it very informative.
Thank you. I appreciate it.
Absolutely. Thank you.
Does anybody who's, maybe if there's any non-dental students from Stony Brook here, have any questions? Thank you, Chloe.
I do have a question. I don't know if you, Jack, or like
Yeah,
Dr. Seeper would know, but what's the likelihood of us third years right now taking the CDCA with the type it on teeth, like the restorative portion? Do you guys think it's very high?
It's probably going to be a consideration. I think right now, all of these licensure updates that are coming out from the agencies and the state boards are really focused on the graduates of 2020 and getting them licensed and taking
Right.
care of them. But I think it's really going to be hard to say based off of if we have like a second wave and how much we're able to get back into clinic, and if the time comes that we aren't really able to see live patients in the capacity that we need to find these lesions, because the lesions are also very hard to come by in many cases,
Yeah.
especially if we reduce patient flow into this clinic, which is undoubtedly going to happen. It could be, and like I said, I don't think that all these examination companies are just going to come out with these like type it on or mannequin-based assessments just for 6 months and then pull it back. Like 8X is like patented it; it has a nice name. Like they're definitely going to keep it as an option. I would think.
Right.
So I think that's a very high likelihood, but I think that they are going to have to address the perio portion at some point, because a lot of state boards are making legal exceptions right now for the graduates of 2020 to not be required to take the perio portion. But if they don't extend that for us and we need to do some sort of perio thing, they're going to have to figure that out, which, I mean, they could literally just paint a tooth with nail polish and have us, or, and they're already, the credits exam, I believe, has the perio simulated teeth that are more than just like painted on nail polish. It's more complex. But I'd say it's a very high likelihood. What I don't think is very likely is that our class, or maybe even the year after us, are going to be taking the DL OSCE anytime soon, unless states really turn around and say, this is an amazing thing, let's do it. I think even though it was piloted, meaning that it was just tested out, I think it's going to take a few states that have already adopted it, like Iowa and Washington, and it's going to take maybe a couple of years for them to see how they're doing, and studies to be done on the validity of that as a pathway, and then maybe more states will move in. But like we said, I don't think that would really be for us to get licensed in New York, because New York is probably not going to budge anytime soon. But it would hopefully be a pathway for future to be like in other states to go elsewhere.
It really
Our House of Delegates is meeting virtually within the next month. And if there's any, and I agree with Joe, I don't think New York is going to change much. But if there's any kind of resolutions or any kind of talk, I will, if I can, bring it back to you.
It really depends on the states. Even though the DLSC has been beta tested by the Joint Commission and the ADA, states, before they accept it, are doing their own testing to determine validity and if they're going to take it. So even if a state has that they're going to accept it, it might not be available for a student to actually take and challenge until next year, because they're using this time to test it out on their own. Or a lot of them are using like next year to test it out before they even make a determination if they want to take it or not. And also going back to Steph's question about using the like comp teeth to challenge like the operative portion, that's also dependent on state, because some states, even though 8X is offering that as an alternative, some states are allowing that to be an acceptable way to use like the 8X exam as a licensure, and some aren't. They still feel like you should have to do a live patient portion because there's questions regarding the validity of these simulated teeth based off of some schools that were using them like as like a mock testing strategy and whatnot. So it really is still state by state and very up in the air and dependent on, if people are willing to budge and swallow their pride, to put it nicely.
Some states have requirements that a pathway to initial licensure is that you have to either take CDCA, CITA, or REB. And that's it. That's all that's really in their requirements. But some states have it physically written into their law that they students must have completed a live patient portion of an exam. So even if they, accept, even if the CDCA and ADEX comes out with these type-it-on teeth, doesn't mean that you could still, and that certain state, accepted the CDCA to begin with, doesn't mean that this modified version of the CDCA without a live patient is now going to be accepted. The state still, in that case, would have to change its bylaws, or change it. The State Board of Dentistry would have to change its rules for licensure to accept that. But it's really going to be a state-by-state thing. And there's a lot of great references that I encourage you to look at, especially the ADA state dental licensure by map. It really
Are you gonna send out this PowerPoint?
Yeah, I'm going to send it.
Okay, awesome. Thank you for your responses, guys.
Mhm.
I have a quick question, Joe.
Mhm.
Can you correct me if I'm wrong, but I heard that E2 lesions are like acceptable, I guess, for the class 2 operative portion. Is that true? Slash, I don't know if that makes sense, because aren't we taught like not to? E2 lesions, are they acceptable lesions?
So it really, you're like, when you're looking for the lesions for the operative portion for the class 2 and class 3, you are looking for the smallest, most ideal lesion that's still radiographically and or clinically with a what do you call it? Transluminator present.
Yes.
So that's like one of the biggest ethical things about like the CDCA and these live patient exams, is that we learn in school that teeth remineralize, and such small cavities that might just be truly cavitated can remineralize if the patient adjusts oral hygiene and takes the measures they need. However, we're treating them because they're so ideal and small that we know that we'll be able to basically drop the box and then fill it and be done with that portion of the exam. So yeah, sometimes you are literally using lesions that are E2 in nature and have, because basically it needs to be, at least the like specific requirements is that it has to be within 1/3 of the distance of the DEJ. So if on the radiograph it looks like that triangle is approaching the DEJ and is, right near where the enamel and dentin meet, then it'll likely be accepted. And we at Stony Brook go through radiographs, thousands of them, of patients beforehand looking for ideal ones. And Dr. Seaver and Dr. Nguyen and Amoya and Dr. Nasty and Dr. Conti are all certified examiners. So then we'll show them the radiographs and they can sign off to say if it's, a good lesion to use, because they go to other schools and, help to administer the CDCA exam, so they know if it's going to be something that's acceptable or not. So we find these really small ideal lesions that we then use to treat. And I mean, sometimes you open it up and we, like, Dr. Pelosi and audience say radiographs are only 2-dimensional, so you're not going to know the full depth of the lesion, but more than likely when you open up that lesion, it's probably a very small ideal lesion. For example, my class 2 that I used was literally just demineralization. I dropped the box and there was a slight demon on the floor of it, and I got rid of that. And it was the smallest restoration I've done since first year operative. I had never done anything as small as that in clinic. So there's a huge ethical concern regarding the lesions that you use on these exams.
Yeah.
The live patient portion of the dental licensure exams is how well can you follow instructions on a test, not how well can you apply principles, of restorative principles you've learned in dental school. Unfortunately, the same goes for, leaving affected dentin. If it's discolored and it's brown looking, even if it's, like that leathery, they'll still mark you, ding you for it sometimes, or it'll be debatable. So people just, get rid of it, even though clinically we know we can leave it and it will be okay. So
yeah, basically what normally people fail on isn't the fact that they don't know or understand the concepts. It's that you have to ask for modifications after you make like an ideal prep or remove a certain amount of further demineralization or, affected or effective caries that you're asking to. And if you use the wrong terminology on your form, because you're not able to communicate with the examiners, so you have to send the patient with rubber dam on with this form that you fill out asking for modification to the back to have it be examined and reviewed by them. And then the patient to come back and you to be told if you can proceed it or if it's been accepted or not. is normally when things get lost in translation and you fail. So, for example, I know not our year, but last year, one of the fourth years who took the exam wrote the pulpal floor instead of the gingival floor, and he wasn't referring or using the correct terminology for restoration that he was, doing, and because of that, they failed him because he didn't show clinical knowledge and competence in regard to the type of procedure that he was doing, essentially. So normally you're getting, a failure or death because of something stupid like that, as opposed to if you actually, did a good composite restoration or, had parallel walls on your, prep and whatnot.
Thank you, guys. Does anybody need me to or want me to go to a certain slide again to see something or have any questions about anything else?
I just had a quick question, Joe, for the alternative, like restorative mannequin portions that the ADEX and other exams are offering. Will it similar to the endo and pros examination? Will they have like specific scheduled dates and testing sites to do that, or is that just something I'm like going to bench lab by myself and sending it into, like, how's that? Did they explain how that works?
I didn't read exactly how they would explain it, so I can't really give an exact answer. I would assume they would probably still have dates, and they've actually on their websites for the examinations that were supposed to be a live patient that were canceled. Many of them have made new dates for the mannequin-based ones. So they are holding dates already that they're planning to have the mannequin-based exams. Any other questions? No? All right, so I'm going to share the recording with the students as well as the PowerPoint itself. And if anybody who's left is not a Stony Brook student and wants me to email them the PowerPoint, you can just let me know